10-month-old infant is brought in by his parents because he is vomiting and not passing stool. His parents say he has vomited multiple times over the past couple of hours, but the most recent time was green. No significant past medical history. On physical examination, the patient is irritable and crying. There is an abdominal mass on palpation in the periumbilical region. An emergency laparotomy is performed and shows a part of the patient's intestine folded into the section adjacent to it. Which of the following is the most likely diagnosis in this patient? Almost all of you got it right, which is great because this is probably one of the easiest questions I've ever come across. Just because you don't even need to think about what the other things might be. They've pretty much given the diagnosis in the question. It says emergency laparotomy is performed and shows a part of the patient's intestine folded into the section adjacent to it. Essentially, they're describing telescoping, otherwise seen in intersection. You don't even have to think twice. But for namesake, I'll just explain why it's not the others. Okay. Hirschsprung disease or your congenital megacolon usually is going to be presenting, or rather you're going to suspect it when the patient fails to pass meconium in the first 2 days after birth, and also on rectal examination you're going to have what is known as a squirt sign. Okay, patient is 10 months old, very unlikely for the patient to present now with Hirschsprung disease, usually diagnosed, like I mentioned, in the first 2 days after birth. Meckel's diverticulum, it can be a lead point for intersusception. Okay, but once again, suspected usually, around the age of 2. Like, the rule of 2 is applied to this. So you can kind of suspect around the age of, 2 years. But even then, the presentation is not really very similar to that of Meckel's. There's no passage of any blood in the stool. Okay, all the baby is presented with is bilious vomiting and an abdominal mass on palpation, the periumbilical region. Okay. Duodenal atresia, pyloric stenosis, both of these can be diagnosed, okay, pretty soon after birth. Duodenal atresia usually within the first week after birth itself, and pyloric stenosis 2 to 6 weeks after birth, okay. The thing is, duodenal atresia presents with bilious vomiting, pyloric stenosis does not. On duodenal atresia, usually you can see the double bubble sign when you take the X-ray of the child. Whereas in the case of pyloric stenosis, you're gonna have a palpable olive-shaped mass usually in the epigastrium. In this case, it does mention that there's a mass on palpation, but like I mentioned, this baby is presenting with bilious vomiting and pyloric stenosis. You're gonna have non-bilious vomiting. Moreover, even without looking at the features, just look at the timeline. The baby's 10 months old, like I already mentioned. You're gonna have both them within the first 2 months of life. Okay, so with that alone, you can just rule it out. And like I mentioned, questions like this, if you get this on the actual exam, these are great because you're not going to take more than maybe 10 seconds to answer the question. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.